Okay, so let's talk a little bit about child abuse and how we can detect it, what our role as nurses is, some of the signs and symptoms that we need to watch for. So first of all, this should be a review. There are lots of different types of abuse: physical abuse, sexual abuse, neglect, and emotional abuse. And emotional abuse can be probably one of the most difficult to diagnose and pick up on, and yet can be one of the more difficult ones for young children to deal with. So some risk factors, because there are definitely risk factors that put one in a greater likelihood of the potential for child abuse. You can see a lot of them there, and a lot of them have to do with social determinants, conditions that we live in, areas that we live in, the dynamics of the family. So social environmental causes. Children with disabilities or children that require a lot of attention and care are at great risk. Certainly, there have been a lot of movies and stories and books written about young children who have been abused by their parents in the confines of their medical needs. Parental abuse in terms of substance and drug use, lack of a job, poverty, any other violence in the family. So if there is domestic violence, there is a greater likelihood that there will be physical violence with the child. In terms of sexual abuse, many of the risk factors are somewhat similar, but there are a few overarching other ones. Females by far are at a greater risk for sexual abuse. Absence of a natural father and instead a stepfather or a boyfriend of the current mother could be be much more of a risk, we see statistically. Mother, if she's working outside the home and leaving the young lady at home. And any other parental conflicts and issues, again, domestic violence would put one at a greater risk for sexual abuse as well. So who typically abuses? Well, everybody often thinks, okay, parent, any guardians or any extended family that may be taking care of or are responsible for the care of those children. Additionally, we do find statistically there's a greater likelihood that an abuser may be a boyfriend of the child's mother. That doesn't mean all boyfriends are that way. It just means that we see statistically a significant difference in the numbers of frequency that we see that. So what happens if abuse occurs? Well, it doesn't take a whole lot of smarts to figure this out. Obviously, there are a lot of behaviors and things that the children will resort to in order to cope or will turn to later in life. So drug addiction, alcoholism, mental health conditions, anxiety, depression, low self-esteem, and we've learned a lot about the role of self-esteem in the growth and development of children. Marital relationships, relationships with same-sex or opposite sex can definitely be affected. Parental relationships get significantly affected in that process. They can be angry at the abuser, but also angry at the same-sex parent who, quote unquote, allowed that abuse to occur. They also can feel very socially isolated and very alone. In terms of signs and symptoms, now this is by no means a comprehensive list, but there's definitely some pretty good examples here of what we would want to watch for. So when looking for physical abuse, bruising, burns, or bones, so maybe the 3 Bs, all in varying stages of healing. So we see multiple examples of them, but we also see them in multiple or various stages of healing. Scald burns, and when I talk about scald burns, often the result of hot water. So we notice them sometimes on, or most often on, hands and feet. So that's why we say glove or stocking demarcations. So the children have been put or doused in the water. Sedation, so we may notice that the kid is overly sleepy or having effects of certain medications that they may be giving the child to keep them asleep or keep them limited in their interactions. Obviously, any social changes, as well as school performance changes, engagement with friends, engagement in the school activities. So there's a lot of information that school teachers and school nurses need to be aware of in terms of what to watch for. For sexual abuse, any of the above things we just talked about, but additionally, we will notice concerns in the genital areas, vaginal discharge, as well as potentially bloody discharge, either noted in the underwear or the diapers, any redness, pain, itching, swelling, bruising in the genital area, sometimes difficulty walking or sitting, maybe one of the first signs that we note. UTIs, STIs, obviously. But one of the other things that we will notice is almost like a hypersexuality sometimes, where they will have a hyper interest or a hyper alert interest in sexual activities and the curiosity around sex. And we may notice them doing a lot of masturbating as sort of a response to the sexual abuse. So in order to prevent it, again, you could probably put this together in your own brains, be aware of what's out there in our risk factors and educate those individuals that come in contact with children on a daily basis. Part of what we as nurses do is educate. Let the parents know that it is okay to walk away from the baby. I mentioned in class this week that I did take my kids and put them down in the basement, or my older son, who did have a lot of colic and led to a lot of frustration for my husband and I, put him in the basement and we went up 2 flights of stairs to get away for a little bit of time. We all need space. It doesn't make us bad parents. It makes us realistic parents and our children normal. Everybody has bad days, and we need to separate ourselves to avoid the risk of resorting to abuse out of frustration. In detecting abuse and things to watch for. So just be alert for the signs and symptoms that we saw and be sure we're teaching people about them. And we need to work to either remove the child from the environment in which the abuse is occurring, report as we are required. We are mandated reporters as healthcare providers. And oftentimes we're afraid to report because we're concerned, well, what if it's not going on? It is better to err on the side of investigating than it is to ignore it and wait till it gets too much out of control or results in the death of the child. We need to make sure that anybody or any child that is in a situation where there is physical or sexual abuse, that we are following up on their mental health status and taking care of any of those mental health concerns that may exist.